This year's Speech Pathology Week is around communicating with confidence, and often when we think about that, we think about how it is we work with our patients and children and clients in a way that allows them to communicate with confidence. But I like to think a little bit more about how is it that we work with the parents so that they can communicate with confidence with their children and then get even better outcomes from their children. And the same goes with carers of people, adults that had stroke. I've worked in hearing impairment for some time, and I used to manage a team of early interventionists that work with children with hearing loss. And we had a little girl with a severe profound hearing loss who was needing a cochlear implant. And in terms of speech and communication, she was presenting as any child would in terms of delayed speech and language associated with a late diagnosis of the hearing loss. This little girl was in out-of-home care. Her mum had lost custody of her daughter for a number of reasons. And at the time she was being evaluated for a cochlear implant, she was about to resume the care of her daughter, which was exciting time for the mum. But interestingly, as part of the team, I found that the people working with the child didn't necessarily view that in a positive light and expressed some concern. And I thought this was not going to be the best option in terms of the mum learning the most and getting the most out of her daughter. And so at the time I opted to move the care of that little girl and the support of that mum from the particular team they were with and putting them with one of our more experienced clinicians who was actually fabulous at family-centred practice. And I'd learned a great deal from her about that. And in that process, one of the things that this particular therapist did with the mum was really meet her with where she was at. She didn't have any preconceived ideas, any preconceived notions about what this mum could or couldn't do, and proceeded to meet her where she was at, asked her what information she knew, asked her what she wanted for her daughter, asked what she wanted in terms of future education. And together they worked in a way that allowed not only the daughter to come along, as she did go on to have a cochlear implant, but allowed the mum to really develop her confidence as someone who could not only teach her child to speak, not only make an informed decision about whether a cochlear implant was going to be the right option for her child. But one of the lovely things that came out of that and out of that mother getting confidence from the clinician that she was working with was that the mum, who previously wasn't particularly strong on advocating for herself or her child, became a strong advocator. She went on to advocate for her daughter when she got to school and needed extra educational support. She went on to be able to help develop her spoken language in a way where her daughter could be understood. And she also went on to be able to advocate for housing that she needed as well to support her and her daughter and her family. And I think we can often forget what it is that we offer as speech pathologists to anyone we work with, whether it be the immediate patient or child, or whether it be the extended family. And I think that's what we always need to think about when we're working with families. How is it we provide them all with the confidence to communicate with the person that has a speech and language delay or disorder, communication issue, and how is it we can give them information and empower them to be confident communicators with them, and go on to do so much more once they leave our care.